Welcome to Chapter 8, Data Analytics. Let's talk about the definition of data analytics. Data analytics in general involves some degree of analysis of any type of data set. The analysis may vary in degree depending on the question that has been asked and the tools that's used to perform the analysis. For example, a healthcare organization might be interested in finding out what is the average length of stay for their hospital. This may seem like a rather easy question to answer. However, upon further analysis, the evaluation of the available data, it could end up being a complex question. The data analyst in this situation may need to figure out all the different data sets that would need to be gathered to answer the question, along with the need to figure out all the variables that may be needed to be analyzed to answer the question. So, what is considered data analytics? There are many definitions across the industry for data analysis and data analytics. Data analysis is the process of systematically applying statistical or logical techniques to describe and illustrate, condense and recap, and evaluate data. Data analytics involve the review of raw data by utilizing specialized tools for creating meaningful conclusions and identifying patterns. To make it real, can you think of an example of data analytics in your setting? One example is a clinic manager uses the Epic Clarity reporting program to pull a list of clinic patients from the Epic Care electronic health record. She downloads the list to Microsoft Excel and uses the sort tool in Excel to list clinic visits by day of the week. She then graphs the data into Excel to show her staff a bar graph demonstrating that Tuesdays and Fridays are their busiest clinic days from the analysis of 6 months of data pulled from the EHR. Let's get into more about the tools, right? There are different tools that are available for analyzing data. Some tools are open source and publicly available, while others may require the purchase of a license. Data analytics does not necessarily relate to just large data sets or big data. And so as we get more into the characteristics of data, as an organization acquire and handle greater or larger data sets, it may grow into an environment of what was called big data. However, any organization that handles any type of data set, historically, current, or prospective, would need to be able to perform data analytics. And so as we talk about data analytics, of course, there's more to talk about as far as that description. Big data can be categorized into 4 main areas, which are the 4 V's: volume, velocity, veracity, and value. So the data that may be too large to handle, it is estimated that every 2 days, human beings create as much as data from the beginning of time until 2003. Okay, so that's HEMA's research. Okay, further, over 90% of all data that were created in the world came from within the past 2 years. With this large data, the importance of having tools, okay? When we're talking about this myriad of data, it's so important to have tools to analyze the data. And this becomes paramount as far as the level of importance. Having that much data, you need to have the right tools to be able to analyze the data. So as we get more into the whole characteristics of data, another statistics show that 1 zettabyte is equivalent to 152 million years of high definition video. So velocity, when we talk about that, it refers to the frequency of data being generated and processed throughout the organization. In a healthcare organization where it's open all year round, the frequency of data that gets accumulated over time per patient encounter, man, you can only imagine how large that is, right? Veracity of data for an organization may refer to the various different forms in which the data may exist. When dealing with healthcare organization, the data may be structured, semi-structured, it can be unstructured. It's just dependent on the type of data source, right? This could make the data more complex to analyze rather than having a single structure for the data. Finally, the most important part is the value of big data. Refers to the importance of the tools that we're investing in that's going to be used by the organization. The value of the data is affected by the decision made by your by our administrative C-suite professionals on how much to invest in data analytics tools. Some of the tools that we will be discussing during this chapter is Microsoft Excel, Tableau, QlikView, RStudio, and also Public Data Web Source. Microsoft Excel is a spreadsheet software used to perform calculations, statistics, and that has been used as a graphing tool, and also many people leverage pivot tables. Now, pivot tables are great for data analysis. Pivot tables allow the users to be able to rotate the data to review from different perspectives and be able to conduct different types of analysis. So to give you an example, when you're looking at utilization, or you can utilize pretty much the data analysis concept to answer a certain question or perform trending or budgeting analysis using Microsoft Excel. Tableau is more of that data visualization tool that transform your data into visually appealing data that you want to present to your executives, and you can present that in dashboards. You can connect easily to many different data sources such as Microsoft Excel in order to export that or import that data into the Tableau. Then there's QlikView is another business intelligence tool for data visualization, and it is used to prep, clean, and analyze the data effectively. And then last, you have RStudio, which is an open source software environment for statistical computer and graphics. And of course, there's public web source. There are different secondary data sources that are available for health purposes, and most of them are publicly available. So some examples include the U.S. government's open data sources, which has thousands of different data sets in various different topic area. The Leapfrog Group is another national nonprofit organization dedicated to providing quality and safety in the healthcare system. And then Hospital Compare provides official data set used on Medicare.gov by the Center for Medicare and Medicaid Services. And this data allows you to compare the quality of care at over 4,000 Medicare certified hospital across the country. Center of Medicare and Medicaid Services, and also chronic condition dashboards are also available. So this ends this part of our session.